Alrighty. Yeah. Okay. All right. Well, welcome. My name is Nikki. I am Dr. Hill's surgical coordinator here at Fulcrum Aesthetics and Surgery,
Hi, my name is Howie. I'm Dr. Hill's medical assistant.
and we're here to speak on the importance of post-operative self-care,
Mhm.
immediate post-op, and then also
Skincare.
skincare. Very important. Let's begin. All right. So, what to expect immediately after surgery? So, immediately after surgery, it's going to be completely normal to feel a bit groggy from anesthesia. Again, this is going to be dependent if you have had a procedure with Dr. Hill that's under general anesthesia. You're going to have a little bit more grogginess waking up after surgery compared to something that was perhaps here at Fulcrum under local. But you will experience some swelling, some tightness, and have a little level of discomfort, but all is to be expected and it's manageable. And then depending on the procedure, you may have some dressings, you may have garments,
Mhm.
you might have a drain. Let's say if you have an abdominoplasty, you will have a drain for that.
Yeah. 9 times out of 10, we are going to send you home with some sort of garment, whether it's here in the office or at the surgery center. So always wear loose, comfortable fitting clothing, especially if you're having, let's say, a breast augmentation. You want to kind of avoid that arm lifting, situation. So something that buns up at the front, comfortable, loose clothing is very important.
Nothing at this stage should feel alarming. This is, simply your body beginning its healing process,
Mm-hmm.
and we'll guide you through the whole thing.
Yep.
All right, so the first 24 to 72 hours post-op. So this is the time of your recovery that can feel the most intense because this is when your swelling and your bruising tend to really peak. This is when you can feel more fatigued. This is when you really want to lean into that resting. You want to encourage your body to still have that light movement.
And hydration.
Hydration, very, very important. Make sure that you're really nurturing and nourishing your body during this time. Again, your body just had surgery.
Yep.
That's your body is doing a lot of work to heal externally and internally. So you want to make sure that you are really allowing yourself to rest.
It's one of the things that patients say to us. Sometimes it's like 24 hours, 24 to 72 hours after, like, oh my God, why did I do this? Because it's just so much going on, and your body's trying to adjust, try to take care of you. So those are all normal feelings to have.
But once you hit that, after the 24, 48 hours to 72,
Yep.
that's when you notice that shift and you're like, okay, body's moving in the right direction.
Mhm.
Things are starting to, move positively. So, why post op care matters? Well, one of the biggest things that we like to remind you as a patient is that your results are not just about the surgery itself. So, yes, Dr. Hill is your surgeon, but he can only control what happens on that surgery table. So, you are part of that healing process as well. You are part of that post op care.
Mhm. We're
So,
sorry.
go ahead.
We're all partners here. You're our
Yes.
partner in this journey together. So we have to all work together to make sure that you get the
Mhm.
results that you're looking for. So yeah, sorry,
Yeah.
panicking.
No, your postoperative care, this is going to help reduce your risk of your complications. This is going to support your healing timeline. This is really going to help enhance your final outcome. It's going to make your recovery feel more comfortable, and it's going to help you feel in control of that recovery as well.
Mhm.
So it is like how we said, it's truly a partnership,
Yep.
and it's between you and your care team.
Yep.
Healing, movement, and support. So, this is when you want to focus on how your body is healing and how to support yourself through it. You want to avoid strenuous activity. This is going to be your heavy lifting. Even if you start to feel better early on, you don't want to, this isn't the time to push your body. This isn't like the latest workout class that you need to like push through the pain. Okay. This isn't where no pain, no gain is. All right. This is your body is still working so hard to heal. You want to make sure you are, like we spoke of just before, you want to do light walking. Um, you want to keep moving, but not too much. Uh,
Listen to your body. If you feel good, some people take a couple of days to even get up and kind of move around. We do encourage light activity.
Yeah.
Some people walk 10 miles the next day, right? We all heal differently. Listen to your body, obviously, following the post-care instructions given to you by your care team and especially Dr. Hill.
And it's dependent on the procedure.
Mm-hmm.
A upper blepharoplasty is going to be different than a deep plane facelift.
Yep.
So listen to the team and
And listen to
suggestion
your
for you.
body. Yeah.
Yes. And just as important that is just making sure that you are set up for success at home. So making sure that you have your essentials within reach and you have a good support system and a support person with you. So essentials again are going to be water, your food, your medications, your phone, having all those things set up for you at home prior to even getting home from your surgery.
I did want to touch on something really quickly. I want to go
Oh,
back to the support
yeah.
part. There's lots of Facebook, support groups for plastic surgery, and
Mm,
we live in the day of social media. It's a big thing, and people want to have a shared community that they go to. But I do just want to touch on that. Not everybody heals the same, right?
yes.
So if one person's saying, "Hey, I had a deep plane facelift, and within 3 weeks I'm great to go," that doesn't necessarily
You're
mean
like,
that'll be your
congratulations.
congratulations. Like that's amazing. First of all, a miracle, I would
We
think,
love
right?
that.
We
Yeah.
love that for you. But we all heal so differently. So example for us is I had filler in the next 24 hours. I was fine. I was like, hey, barely bruised. Nikki had filler and
I blow up.
she blew up, right? So she's a sweller. I'm not.
Yeah.
Everybody heals differently. So those groups are great to join just to kind of have information, but don't base anybody else's result on that.
Yeah.
And true support that you're looking for is going to come from your care team and from the instructions that you are given by Dr. Hill,
hmm
Nikki, and myself. And we're here to truly support you through that.
Yeah.
Yeah,
Yeah. And your procedure is customized for you.
exactly. Okay. So next one. There you go. Oh, God.
When to contact your care team. Okay, so one of the things that we utilize here at Fulcrum Aesthetics and Surgery is the Spruce app. This is a HIPAA compliant app. We love it. This is something that we invite you to download. So it has to be an invite to download here at your pre-op. So if this is your two-week pre-op or if it's your same day procedure pre-op appointment, we invite it to you. And this is the only people that have the app would be you as a patient, Dr. Hill, myself, and Hawi. This is great for any questions that you have pre and post-op. So if something feels off, if you have any increasing pain or swelling, this is the time to reach out to us. If you have any questions on your medications, any prescriptions that were called in for you from Dr. Hill, maybe it's a previous medication that you were on that you went off prior to surgery. If you're wondering if now's the time you can go back on it. If you have any healing concerns or you just need some reassurance, it's never a bother. We're always here for you, no matter what.
Especially after, if you go under general and you wake up, you're going to be a little groggy.
Yeah.
Obviously, Dr. Hill will be there before you wake, after you wake up, he'll talk to you, kind of go over instructions again. But sometimes you just are not going to remember everything that's being said to you in that state. And we send that message through Spruce. So
Yes.
we never want you to assume anything about your care after your care, your post care. Just always ask us. Like Nikki said, you're never a bother. No, some people are like, I'm sorry, it's on the weekend. I'm texting you. I'm like, it's okay.
Don't care.
It's either
Ask.
Nikki, myself, or excuse me, Dr. Hill. We're always monitoring that app.
Yeah.
So you're never a bother. Always reach out. Never assume. There's no such thing as a stupid question.
No.
We're here for you to guide you through this.
Yep, 100%. So when to contact, just do it.
Yeah. We're actually looking forward to your text and
Yeah.
pictures. I get so excited when they send me like pictures like, oh my God, I'm like, you look
Right.
I can't wait to see you.
I
So
love those post-op
I
photos.
love.
All right, so smooth recovery. If, key takeaways from post-op, follow your instructions closely, stay hydrated. Once again, nourish that body.
I was not on cue. I was just
But most importantly, be patient with yourself. Be patient with the patient. That's you. It's really, really important. Allow yourself a little grace. It is surgery after all.
Yeah. And it's okay to be like, hey, I'm nervous and have all that stuff.
Yeah.
That's why we have you come in, your pre-op We tell you what to expect. We go
Hmm.
over, give you detailed instructions. Um,
Yeah.
just listen to your body, listen to your care team,
Yeah.
and we'll get you to where you want to go.
Trust the process.
Trust the process.
Yeah.
All right.
And
So
that.
we go to my favorite part, the skincare. Okay, so one of the reasons we emphasize skincare, it's really important and essential part of your healing process, especially when it comes to things like incision scars, pigmentation. If you are a person of color, we just tend to pigment a little more, right? So you want to make sure you're taking care of your body and your skin before you do any procedures and after. It kind of, protect your skin barrier. It provides long-term results because surgery, great, it fixes it, but you need to invest in that procedure that you had. Things like a neck lift, continue to use your products that you will recommend for you to use here. So we'll go a little bit more into the products that I like and that I use and what we do recommend for you. So one of the things that we like to do is start you on the simple medical grade skincare prior to your procedure. Sometimes we do it 4 to 6 weeks. Sometimes it's 2 weeks. If you're having procedures done like a CO2 laser, we'll have you do hydroquinone to pre-treat the area. Again, stay hydrated, avoid tanning. A lot of the times, Dr. Hill will do CO2 laser after a procedure, after surgery. And if you're tan, that's just going to mess with the results and it can cause you to have pigmentation, which we don't want, right? You want to avoid things that are harsh, like retinols, anything that's like exfoliants, harsh scrubs unless we tell you otherwise. So listen to us and follow that skincare. And then one of the products that I do like here is the Cloud Wash. It's just very soothing, gentle foaming cleanser that I use every day. But we'll switch you to this so your skin is safe and protected before you start the procedure. And then obviously sunscreen is the most important thing. We do have a product here that I love. Elta Clear. This is clear, so it's no pigment. It just goes on clear, right? And they do have a BB, like a BB cream tint. If you do want a little bit of coverage, especially after like a laser, protection is key. And then, so basically everything I just said. So I kind of went ahead of myself there. Yeah, so gentle cleanser, no scrubbing the area, especially after it's a CO2. Nikki does a great job of giving you a little postcard that gives you all of the instructions that you need, like for after a CO2. So yeah, so just, and then obviously silicone scar gels. We have the scar edit here that's really great for incision scars and then pigmentation as well. And what's the other one that I love here?
You
Yeah,
love it all.
I love it all,
Yeah.
honestly. I
I mean,
really
the
do.
key is it's the gentle care
Mhm.
supports the optimal
Yep,
healing.
yep. Again, same thing we just discussed earlier. Avoid things that are harsh to the skin. And like we said, when in doubt, just keep it simple and reach out to us and ask any questions. We're able to guide you through it.
All right. Thank you guys so much for joining us. We are now here and open to any questions that you may have.
Okay.
Let's see. Okay. What's the difference? Answer live. Okay, here we go. What is the difference between local and general anesthesia? Does it matter on the procedure I have? That's a great question, number one. So the biggest difference between local and general anesthesia is local, you'll be awake. General, you're going to be sleeping. So that would be like the biggest difference. And it does definitely matter on the procedure that you have. Perhaps you want to touch on this a little bit as
Yeah.
well.
So general, again, you'll be in the OR, you'll be put to sleep. There will be an anesthesiologist there that monitors that.
Yes.
Local is done here in the office, sometime so in the office here by Dr. Hill. A little bit of a poke, a needle in the areas. And I'm kind of like when you go to the dentist and they do,
Yeah.
numbing. That's essentially
Think
what
of it as like it's
it's
localized.
localized to that area. And there's no grogginess with that. There's no issues with that. It's kind of like, oh, I just don't feel anything in this area while we do what we need to do.
Yeah. Yeah. So think of like general is at a surgery center, you know, put under
Put under to
locals.
sleep.
Here you're awake.
Yeah.
You can walk out.
Hmm.
All right. These are great questions. Next
Yeah.
questions. Well, oh, no, no,
This one
this one. There we go.
here.
How do I prevent Scarring. Well, number one,
Skincare.
well, if you have a surgery, you also will have a scar.
Mhm.
So there's things that you can do to reduce, but
Yeah.
you will have a scar. But
When you're cutting into skin, right, you're bound to leave a scar. There's no way that we can go around, there's no such thing as no scar surgery. That's just not a thing. But Dr. Hill does a great job of post laser care.
yes.
So he'll have you come to the office, 1 week post procedure, he'll go over it. If a laser can be done at that time, like a BBL laser, a YAG, he'll do that.
Hmm.
And then we have you come back in 1 month. We do another laser, CO2, or the QS laser that we have here, which kind of pulls the pigment from it. And then he just makes sure that he follows up with you and make sure that you are healing properly. We also do Kenalog injections that can
Yeah.
kind of bring down the inflammation.
Yep. Dr. Hill very much prides himself on his post-operative care when it
Hmm.
comes to your healing and your scarring.
Yeah. Even if you're happy with it, if he's not, we're not letting you go. You have to come back and see us. Are we going to do another round of whatever that we need? Because he truly is an artist in what he does,
Mhm.
and he wants better results for you than I think sometimes we're like, oh, I'm good to go. And he's like, no, you're not. Come back. I got you. So yeah. And you really can't prevent scars like Nikki said.
Okay. Oh,
We didn't answer.
touch on this. Well, will I always have scars, and what does Dr. Hill do to reduce them? So, just same,
Same
yes,
thing. Yeah.
yeah.
So scars can take up to 2 years to fully heal. Um, but that's why we do the lasers, we do the Kenalog injections to help minimize it. But over time, it can fade, but it's not going to be 100% gone because, again, we are causing trauma to the skin. We are cutting it open, right?
Mhm.
So it's not something that we can 100% prevent, but we can 100% help diminish it and make it less visible over time.
Yeah, this is a great one.
Mhm.
When can I get a skincare recommendation?
Okay, so you get that done. You can do it at your consultation. So sometimes you come in, you go, "Hey, I want this done." We go, "Okay, well, this is what you need to kind of start on before we do the treatment." So, for example, if you're coming in for full face CO2, you have the consult. I go over that you do need to treat with hydroquinone for 2 weeks prior to your procedure. So we go over it at your consult. We can go, and then sometimes if you don't need it. We can go over it at your post-care 3 month visits or whenever you really want. Honestly, I'm available 24/7. So you can contact me anytime for any skincare recommendations.
Love it.
Mhm.
Are there foods or drinks that can slow healing or interfere with my aftercare? Oh, answer live. I keep forgetting. Alcohol, first of all. Alcohol can definitely,
Smoking.
yeah, and smoking. Alcohol can definitely slow down your healing or interfere with your aftercare. When I think of foods, I think of, I just think of anything
No
like this is going to
salt.
cause inflammation. Yeah,
Yeah.
I'm trying to think, salty foods.
Hmm.
I,
Anything that you consider junk food and that you don't want to eat on a daily, you don't want to do
yeah.
after your procedure. You want to think healthy, you want to think greens, you want your water, no smoking at all
I,
before the procedure as well,
yeah,
because that can help with, sorry, go ahead.
no, I'm sorry.
That can help, that can interfere with healing, bleeding. We don't want that. And drinking, we do say minimize it. But we go over all of that. And obviously, we get to know you and know your lifestyle, and we can
Mhm.
make recommendations and adjust as we need to.
Yeah, I was just gonna say, I think of myself because we were talking about injections
Oh,
of
yeah.
rice. Well, if
Hmm.
I know I'm gonna get any kind of injections, I like really hold back on
Yeah.
those salty foods because that's a problem. Okay, do I need a caregiver to drive me home from my eyelid lift? So that is dependent. So if your eyelid lift was here under local, so you have instructions. For me, you are.
I
Well, it's
say yes.
dependent.
I say yes because
Yes, if your eye if your vision gets blurry.
yeah, because
Yeah.
oftentimes, again, Dr. Hill doesn't just do one procedure, so he'll do a CO2, right? And if we're doing CO2 on the eyes, we do need to numb the eye, which is going to be basically your eyeballs, and we need to put eye shields in, and that can cause a little bit of blurriness, and sometimes it can cause swelling and your eyelids just to feel a little heavier, right? So I would definitely recommend for somebody to drive you home, or at least have a trusted
Hmm.
driver that's available to take you
Yeah.
home.
Because if you think about it, I mean, if you're, it depends again on the procedure and if you have it matched with something else. It also is dependent if you have taken any kind of
Tramadol.
tramadol, but upper blepharoplasties, that's a lot of times there's no narcotic that is prescribed and it's
Mhm.
not under general. But that being said, you may have a lot of swelling. So again, that can obstruct your vision. So that's something that we would talk about at your pre-op appointment and at your consultation.
Mhm.
What does a pre-op appointment entail? Okay, love this. Well, your pre-op appointment, so if this is a procedure that's done at the surgery center, your pre-op appointment is going to be 2 weeks prior to that surgery. If this is a pre-op appointment that is going to be for a procedure here at Fulcrum, it's on the day of. So there are going to be two kind of different types of pre-op appointments. We'll discuss the one if you're having surgery at the surgery center. So at that pre-op appointment, you would meet with me first. We would go over the details of your procedure, the date of the procedure. We then would do your final payment for the procedure. I give you your pre-op box, which has a few things in it for you for your post-op care. We go over your prescriptions. We go over just kind of basically everything. I have you download Spruce at that time. I
Mhm.
go over any additional questions that you may have. Then I grab Howie and Dr. Hill.
So Dr. Hill will come back in. We'll kind of go over your goals again, and oftentimes we have patients send us in goal photos of like what they want to achieve. We go over that. We review their goals with them, and then I do the measurement for the garments that's needed, if needed. We do blood pressure, your pulse, your oximeter, just make sure that you are healthy. Go over your medications. Um, Go over your medications. Anything else that we need to address, post care, wound care, things like that will be done at that visit.
What are the biggest mistakes you see patients make after a procedure? Oof, being too hard on themselves.
Mm-hmm.
That's a huge one.
Mm-hmm.
Not allowing themselves any grace, pushing themselves. Um, yeah, that would be the biggest mistakes. Or
Or assuming, like, that's why I said never assume anything. Ask
mhm,
us, we're here for you.
yeah,
Or going back to social media and looking up or, going down Dr. Google rabbit hole and being like, well, this is what I saw, this is what I read. We're different. Everybody heals differently.
yeah,
You have to give yourself grace. You have to give your body the opportunity to heal how it heals. Because if you
hmm,
rush anything or you assume something, it can cause you not to be happy with your results or delay your healing, which we don't want.
yeah,
So I think that's one of the common things I see. It's like, oh, well, I researched and I saw that. And I go, well, you're not that person, right? And people, you have to remember, people only post their highlights, right? Nobody's going to
right.
say, like, this is what I like, I was down that, right? People only show the good. So you can't just look at a few tailored highlights and assume that's how you're supposed to be or how your
Hmm.
healing should be. Ask us. We're here. We're here to support you. And Dr. Hill does a great job of making sure that he's always available for patients if you have any questions or if you need to come see him day of questions that you have, right?
Yeah,
So yeah, just don't be hard on yourself. Don't assume. Ask. We're here for you.
your journey is yours.
Yeah.
Can I get, oh wait, no. Oh, oops, I skipped one. Sorry. Can I get a boob job and a facelift at the same time? That is something that would be discussed with Dr. Hill in your consultation. It is going to be dependent on surgical time needed. At times, a facelift is going to be a longer surgical
Mhm.
time because it's not always just a facelift. So that is something that I encourage you to reach out to us about, and you can have that consultation with Dr. Hill to see if that is something
Yeah.
that you can have together.
Generally,
Typically,
yeah, because it depends on anesthesia time you said, and you want to do a procedure that's safe amount of
exactly.
hours that you can be under. So Dr. Hill doesn't necessarily do them at the same time, unless let's say you're doing a mid phase, like doing a tiny lift or like a
Well,
brow.
and that's why I would just encourage this to reach out because
Yeah.
sometimes, you know, maybe it's not a full facelift too.
Hmm.
So I would just encourage you to reach out to us
Yeah.
and we can further discuss that.
That's why consultations matter and they're very important.
Do I need supplements like protein shakes, iron, or vitamins, etc., or can I get everything from my food and be fine without the additional supplements? Um, Yes, you can get everything from your food and don't need additional supplements. Or if you are someone that likes supplements, then you can supplement.
So we give them arnica sometimes, which is a
Yeah,
supplement that can
yeah,
help with the healing. Again, that's something that we discuss with you at your pre-op visits and let you know what you do need to do. But nutrition is always important, no
for
matter what,
sure.
right? It's not just for procedure. Nutrition is always important, and we always don't have the iron level. Like I know my iron level is always low, right? So it just depends on if that's something that you need outside of the procedure.
If
But
that's your normal
that's your
thing,
normal thing.
then we should discuss it because there
Yeah.
might be some things that you should stop taking.
Hmm.
But if that's not your normal routine, that's not something that you need to spend
Or add
an
on.
extra amount of money and time doing. Food is very nutritious at the
Yeah.
same time. What activities can impact results if done too soon? If you are a heavy lifter, if you are a
Mhm.
CrossFitter, that's, I don't know. Um, if are a long distance runner, if you are, even certain things like you're gonna go the next day and do heavy gardening, don't do that. Big sports.
We go over with you what activities you can and can't do, right? So if you've had, let's say, a reverse abdominoplasty, we're gonna say, no, you can't always just sit up straight immediately because that suture is there. You might be a little hunched over. This
Hmm.
is when you listen to your body, how it feels when you're doing certain procedure, certain activities. If you had a breast augmentation, we say limit activity, excessive like pectoral muscle workouts because you don't want to move that capsule while they're still healing. This is when you listen to your body, you ask us questions, and if anything hurts, just stop doing it and let us know, and then we can tell you how to adjust. But again, it just depends on what you've had done, and we go over what you can and can't do.
Listen to those post-op guidelines.
Mhm.
I have two kids under 4 at home. I want a tummy tuck, but heard I can't lift them for 6 weeks. What do you recommend? Okay, yes, that is an excellent, excellent question.
Yeah.
Two kids under 4 at home. So number one, the question would be, do you have help at home? That is going to be number one, because it is very, very important. If you think a tummy tuck or an abdominoplasty is a very, very big surgery. That is one of the surgeries we discussed earlier, where you will have that drain. You will have you have an incision. So the reason why we don't want any lifting, pulling, or pushing is because you do have that incision. You had surgery. So little kids under 4, sometimes they do like to be held and picked up.
Yeah.
Sometimes they do run and bump
Jump
into
at you.
you. So
What you can do is, we don't want to say don't pick up your kid, don't bond with
no.
your kid. What you can do is have somebody kind of hand them to you and you can hold them, obviously guarding your incision. And if you do have a drain in, guarding that as well.
Yes.
Picking them up, it's just a no until we give you the clearance.
And as we go through post-op, so at 1 week, typically your drain's removed. And then the guidance as we continue throughout those 6 weeks, definitely there's, different procedures and different guidelines for lifting. And if in a, not in an emergency, but we just like, if there is a time and it's like slowly in, we always think of like T-Rex arms.
Yeah. This is again when you
But,
listen to your body, listen to your care team, follow your
and
postcard.
have a support system at home to help you.
Mhm.
Because two kids, no matter what, without an abdominoplasty is a lot. As a mom, I know. How can I feel more confident navigating the days after surgery? Oh, that's important. Just believe in yourself and make sure again you have that support system and make sure that before you went into surgery, your home, you had those essentials set up for you and that you listen to the care team and follow the guidance and be you,
Yeah.
you do you.
Um, I would recommend just kind of going over what you might look like, right? So again, we go over that at your pre-op. We say you're gonna have some swelling. You may not want people to see you. Just set up your home and your time
Hmm.
how you want to.
Yeah.
It's your turn to be a little selfish in this moment and take care of yourself and do what you need to do to feel comfortable and confident. If that means, kind of not seeing anybody and going
Hmm.
on a little D&D trip at home by yourself, I say, binge on some Bravo Housewives, relax,
Yeah.
enjoy, hydrate, and just take care of yourself and your mental health. You don't have to do anything that you don't want to. Just,
Yeah. You
yeah,
don't have to be anything for anybody.
anyway.
Take care of yourself.
Yeah.
Are there any other further steps of post-op care for a person of color?
So that's where the hydroquinone comes in.
Yeah.
Like we pre-treat and we have you treat afterwards as well to help with that. Our scars can just be more visible, let's say, than a person that's a little bit more, Nikki, she's a little more pale than I am, right? So
Pasty.
I like the word pale. So my scars are going to show up differently than her scars would. So just again, this is when we tailor the skincare regimen. We tell you what you need to do. Obviously, avoiding the sun is universal for no matter what your skin type is, and taking care and doing that laser that you need to do, the hydroquinone if you need to do it, and laser treatments with Dr.
All right, last question. How soon after my consultation can I have surgery? Excellent question. Again, that's going to be dependent on what type of surgery it is. And if this is a surgery that's going to be under local or under general, it's going to be dependent on Dr. Hill's schedule. So typically, we like to say 1 month to 2 months after. If this is going to be a shorter procedure that we can do here at Fulcrum, sometimes it can be a shorter window. It just really is dependent.
Well,
It's a difficult question to
yeah.
answer
It's under
because
his
it's
schedule, and
dependent.
then that's the OR, if he's operating, obviously,
Yeah.
at the OR center, it's their availability and Dr. Hill's availability. If
Yes.
it's done here at Fulcrum, if it's something that we're doing locally, we do have, again, that depends on Dr. Hill's availability. But Nikki does a phenomenal job of squeezing you in, and not squeezing you, but making sure that there is time allotted for it.
I'll do my best to
She
accommodate.
does a great job.
All
All
right.
right. I think that's all the questions we
So
had.
the questions, thank you guys so much.
And then
Oops, sorry, I almost did the wrong thing. There we go. So
So just wanted to, for joining the webinar, you can scan the QR code there. You can get
mhm.
15% off any of the Fulcrum skincare or merch. Use the code NickHow15, and that's valid through April 28th. And then really fun, exciting news for next week. We have our nurse practitioner, Jess, who's going to be doing a master's class on RHA fillers and Daxxify, which is one of my favorite neurotoxins. And scan that QR code
Tune
and
in next week.
to sign up for the webinar.
Yes. All right. Thank you guys so
Thanks, guys.
much.